Patients we spoke to in Tigrai General Hospital say that they're still in despair and suffering despite the signing of peace deal in November 2nd. The patients say no implementation or improvements have been witnessed, although the peace deal has been signed 2 weeks ago.
I am pensioner. I suffer from diabetes and hypertension. The peace agreement has been signed. That means that we should have received the required medical supplies, but we haven't got any. We are all suffering.
A father we found at the hospital expresses his concern regarding his son who suffers from pneumonia but is unable to find any medication.
My son suffers from pneumonia. He has been admitted to this hospital for 2 weeks now. He is subjected to this suffering because of lack of medication. There is no medication at all. He is facing a grave risk.
The patients say that the peace deal is appearing questionable despite their desire for peace to be true and urge the Ethiopian government to implement the peace deal it signed.
Everyone wants peace. We want peace and stability, so we urge the Ethiopian government to supply all the needed medication and food into Tigray.
It has been more than 2 weeks since the peace agreement was signed, but we haven't seen any improvement to this day. This is making us question the peace deal and its implementation.
The head nurse at the hospital, Abarash Fasai, explains the grave impacts and heavy losses that were caused due to lack of medication at the hospital.
When we look at the general data, our hospital has experienced 8 deaths of diabetic patients, 16 children aged under 5 due to malnutrition, 3 due to hypertension, and 32 others have died due to heart cases, and a death of a mentally ill patient. 14 were also HIV patients. And as for the people who died and got injured from heavy artillery shelling, although there are people who died in their homes, the hospital data shows that over 98 patients have been admitted, of which 19 died. 24 got heavily injured. In total, including the people who were admitted dead, our hospital has seen 313 deaths records.
The patients and health workers urge the international community to help in ensuring the implementation of the signed agreement, as well as to help pressurize the Ethiopian government in abiding by it.
I urge the international community to ensure the implementation of the peace agreement and pressure the Ethiopian government.
Humanitarian aid and medical supplies should have flown into Tigray immediately after the signing of the peace deal. However, no humanitarian aid or medical supplies have entered Tigray. Immediate humanitarian aid must enter to save the remaining people in Tigray.